these traumas could lead to food addiction. Where does depression come into this? Because these traumas may as well just lead to, they do, in some people, lead to mental health issues, right? Depression being one of them. And is there any link between depression and then processed food addiction? Does one lead to the other?
Yes, such a good question. And these are the challenges with doing research on early life, because you're recalling exposures in the first 18 years and then figuring out like what was the trajectory of symptom onset, right? Like, did someone develop food addiction and then become depressed, or did they have depression that led to food addiction? And this is, what we call the bidirectionality. Both pathways exist. I know that the risk of being depressed or having depressive symptoms is 2 to 4 times following early life adversity. So those that have ACEs are like 2 to 4 times more likely to become depressed or have depressive symptoms in their adulthood. I do suspect that a lot of that could be mediated by food addiction, because ultra processed food is highly available everywhere. And I think it is a very early symptom of trauma, for a lot of people. And we know, and there's a lot of data to support that people that eat more ultra processed food are more likely to become depressed, right? So I would like to see more research on that pathway: early life trauma, food addiction to depression. And of course, some people have depressive symptoms for a wide range of reasons. It could be more, psychological in nature. They ascribe a lot of meaning to their early life adversity, have family dysfunction that persists over the lifespan. If someone's not in touch with their family in their adulthood, these are other contributors to depression. But from the biological standpoint, the early life adversity to the ultra processed foods to the depressive symptoms is definitely a pathway that I'm interested in. But like I said, the other pathway is also very, very common, which is that someone is traumatized, very depressed, and then they turn to ultra processed foods to make the depressive symptoms sort of go away in the short term. So it would be difficult to tease that out unless we did longitudinal research where we followed people prospectively rather than looked at it retrospectively. When you look at it in the past, it's going to be hard to know which one is the actual pathway. There are statistical methods to investigate that, but the real way to figure that out is to follow people for, a few decades. And that's just hard to do. It's expensive. It's hard research to do. And I wish that I could do it.
And it's not been done yet. Nothing like that has been done.
Not with food addiction. We know they've done it with depression, right? Mm-hmm. People that eat more ultra processed foods are more likely to develop depression. That's been shown.
Just a small experience from my own community, and the group of people who are not able to control their blood sugars because they go into sort of binge eating every couple of days. I know that they come back to me and they say, I've been bad. I've really been bad. I was doing so well for a good 42 hours, normal blood sugars. Then I ruined it all and I'm feeling absolutely horrible. And in fact, obviously, I'm not a clinician, I'm not a physician, I can't diagnose them. I don't know, and I don't even ask if they are diagnosed as being clinically depressed. But that feeling of total failure and sadness for what they've done, and that they had no control over it. They couldn't control their behavior. They didn't knowingly ruin their blood sugars, but they just could not control their behavior. And then they feel so unhappy and sad. Mm-hmm. In one case, I had someone saying, I'm feeling suicidal right now. Mm-hmm. They're crying her heart out. And so that's my experience with sort of depression and processed food, so binge eating.
Yeah. a lot of people would use that as the argument against doing extreme diets for some people. Because if, some people will be able to thrive and get their blood sugar right where they need it to be and feel like $1 million, feel amazing. And then the next person is going to have persistent feelings of failure and guilt and shame. And that creates a spiral and a cycle. And right, that would be the reason why some people would be much better off just being consistent with food. And I have a theory that a lot of times that reaction that people have from, rebound eating, sometimes it has to do with, their blood sugar. Sometimes it has to do with dopamine, right? Sometimes it has to do with this thing we're talking about, food addiction. But in other cases, it might also be because some people who do lose weight, if you're much lower than your highest ever body weight, some people's bodies are okay with that. Some people's bodies are okay being less than they used to be. And this is coming from my experience working with people for 10 years now. There are some bodies that are not okay in a suppressed weight. And that if someone's like 60 pounds under what they used to be, their body's going to be fighting to gain that weight back. And that's something we're thinking about. And it's difficult news for some people. Some people can live in a body that's smaller than it used to be. And other people, when they try to do that, it's just the pathway towards weight gain and eating is so persistent and the body does not give up.
That's interesting. And this is why we have to emphasize health, mental health, physical health, more than weight.
Yes.
Look, so yeah, I always focus on health.